So welcome to the Gen AI YouTube live session. So today we will be discussing about this new concept called MedGPT. So let us discuss what MedGPT is. So MedGPT also stands for. So first, let us go through the agenda. So these are the concepts we are going to discuss. Roughly, we will know the architecture, the key foundation and components, and the basic training and key parameters that have been used, and so on. So, what is MedGPT? MedGPT is basically a medical LLM that is a powerful AI tool that is making waves in the healthcare field right now. So, it is a AI-driven medical document platform that is LLM based. It is an AI tool that uses natural language processing and machine learning to analyze vast amounts of clinical data and predicts future medical events. So, right now, MedGPT was founded by MedLinker. So, MedLinker is basically, let me show you what MedLinker is. So, MedLinker is a platform that is used for recruiting doctors and pharmacists. So, on on May 25th of 2023, MedLinker has launched MedGPT, which is China's first homegrown medical large-scale language model, which was founded based on the transformer architecture. So, MedGPT, it uses the latest advancements in natural language processing and machine learning to analyze vast amounts of clinical data. And based on that clinical data, it will predict the future medical events. So, MedLinker, which is actually a social networking platform, it is used for recruiting doctors and pharmacists. So, MedLinker has launched this AI tool, which is an LLM-based tool, which will make much improvements in the medical field. So, it improves the efficiency in medical document generation, medical transcription, data analysis, and medical consultation through advanced AI technology. So, for example, we have a patient that is experiencing maybe chest pain or shortness of breath. So, during a consultation, the doctor takes notes, right? So, MedGPT helps organize those notes based on the voice recordings. Similarly, medical transcription, data analysis, and medical consultation is also done. Moving on to the key foundation and components of how MedGPT is built. MedGPT was built upon the GPT-2, which is Generative Pre-trained Transformer Architecture. So it is known for its ability to generate realistic and coherent text. So here are the components, some of the components on based on which MedGPT works. First, we have transformer encoder. So it basically processes the text input sequentially. So for example, somebody takes clinical notes, the data is often unstructured. So transformer encoder will process the text input sequentially, and it employs the multi-head attention mechanisms to capture the relationships. So let us first go through the key components and then we can understand how it is implemented in, say, a medical setting. So we have transformer encoder, then we have named entity recognition and linking. So MedCat is integrated for identifying and linking the entities. So, for example, we have names of disorders, we have medications, and certain procedures that are very domain specific to the medical knowledge. So, based on those, using named entity recognition, they are integrated. And it is very crucial for structuring and unstructured text data. So, as I have mentioned, like when somebody takes clinical notes, they are often in an unstructured manner. So, named entity recognition is very useful when it comes to that. So moving on in the architecture, we also have data input. So the clinical text data, such as patient records, discharge summaries, or medical notes, is fed into the model. So this data can be in various formats, including unstructured text, structured data fields, or a combination of both. So in this model, the pre-processing takes place. So using tokenization, the so-called text. So for example, we have clinical notes there. So based on that, the text is divided into individual words or tokens, forming the basic units for processing. And as mentioned earlier, we also use named entity recognition and linking. MedCat, which has specific words related to the medical terminology, is integrated into MedGPT. So it identifies the medical entities like the names of specific disorders, particular medications, and procedures within the text and links them to the standardized medical terminologies. This creates a structured representation of the clinical information. And also, additionally, vectorization is also done, so the tokens and entities are converted into numerical representations that the model can understand. So moving on, we have, as mentioned, we have transformer encoder, which first processes the structured data representation, and the multi-head attention mechanism. It captures the relationship between words and it picks up a deeper context. So then we get to prediction or response generation. So the model is first analyzes the processed information to predict the medical events, such as what a potential diagnosis can be, or what are the possible complications, or what could be the treatment responses. So these predictions, they can assist the healthcare professionals in making informed decisions. Then we have the output. So the model, it produces its output, which can be a prediction. And like it could be a generated text response or it could be structured data. Depending on what the task is, the output can be used by the healthcare professionals to then support the purpose. So, for example, so what does this mean? Let me explain with an example. So this is a healthcare setting. So let's say a doctor has taken certain notes of a particular patient. So, for example, the notes say the patient is experiencing severe chest pain and shortness of breath, and we have a few notes. So, what happens first is the transformer encoder. It will understand. It will, if we look at this words in the double quotes, it will pick up that it will pick up certain terminology. So, it will understand that chest pain or let us say shortness of breath, they are symptoms, and it will also recognize that ECG suggests myocardial infarction. So this implies that the patient is having heart attack. So it recognizes the patterns here, and it will also capture the long range dependencies. And then the named entity recognition, it will identify the symptoms, it will pick up certain keywords, and it will identify them and put them in particular category. So, for example, chest pain is a symptom, myocardial infarction is a diagnosis, and aspirin is the name of medication. So, that way, the named entity recognition, it specifies each terminology separately. So, later we have pre-processing. So, as mentioned earlier, tokenization is taken place. So, the sentence will be split into words or tokens for certain, like for further processing. So then named entity recognition and linking is also done. So after the pre-processing where the tokenization and the vectorization is done, then the transformer encoder will pre-process the structured text and it will identify the relationships. So then we have the prediction or response generation. So the model will predict the potential future risk based on the patient data. So, for example, it can say risk of heart failure high. So then finally coming to the output generation, the MedGPT will generate structured outputs for healthcare professionals. So it could possibly say like likely myocardial infarction, immediate hospitalization advised. It could like give outputs such as that. So finally, these are the five components that are used. Moving on to the training and key parameters. So while training the MedGPT model, which is done on GPT-2 transformer architecture. So MedGPT is essentially it is trained on a large corpus of health records. So we have a lot of clinical information. So what MedGPT is done is the model is trained on lots of a large corpus of health records. So using this clinical records and information, it will learn patterns and it will learn and pick up patterns and relationships in the clinical text data. So it is trained directly on the target task of predicting future medical events without requiring fine tuning. So here are a certain parameters based on which the model is trained. So we can specify how many layers, how many transformer layers we have. We can specify the number of attention heads. Similarly, we can also say embedding dimensions, learning rate, batch size, and warm-up steps. So based on these training and key parameters, the MedGPT model is trained. So for this, there are some other benefits as well. As MedGPT can also be used for answering complex clinical questions. It can also help in generating patient reports or summaries. And we can also use it for coding the medical records and identifying the patterns and relationships in clinical data. So other than that, additionally, MedGPT, here are some of the future predictions that MedGPT LLM can achieve. So MedGPT's LLM, it can be used for tasks such as automatic coding of medical records, answering the complex clinical questions, and even generating patient reports. And as more healthcare data becomes available, the MedGPT LLM can be continuously trained and refined, constantly enhancing its accuracy and capabilities. So, the more information, the more clinical information that the MedGPT is trained on, it becomes more and more efficient. So the MedGPT LLMs, its ability to analyze massive amounts of clinical data and predict future events has the potential to transform healthcare practices and improve patient care across the globe. While of course when it comes to AI, there will always be certain ethical considerations so the responsible development will always remain crucial. So we have to keep in mind what kind of data we are giving it to train and maintain confidentiality, and we have to maintain certain ethics. So as long as we are doing that development responsibly, it will significantly help in the forward of medical AI. So MedGPT LLM undoubtedly marks a promising step towards a future where AI powers healthcare professionals to provide a higher standard of care. So let us compare two of these AI tools. One is MedGPT that we have discussed, and the other is BioGPT. So let us see what BioGPT is first. So similar to MedGPT, BioGPT is also an AI tool which is LLM based. So it is this one is more domain specific to biomedical terms. So similarly, it is very similar to MedGPT. Just a small difference is that it is more specific to biomedical terms. So here we can compare the features of MedGPT and BioGPT. So when it comes to features, so the data that is used for trainings, MedGPT gives like broader data set, and it also includes the PubMed abstracts and the clinical notes. Whereas coming to BioGPT, it targets the data set of PubMed abstracts, which is scientific literature. So BioGPT is more theoretical in nature. Coming to the model architecture, MedGPT is based on GPT-3, whereas BioGPT is based on a transformer. So it is better at understanding the relationships. So coming to downstream tasks, MedGPT has a general purpose NLP task. So question and answers, summarization, creative writing, etc. But coming to BioGPT, it contains more biomedical text mining and information extraction tasks such as NER relation, classification, and information extraction. So the strengths, when it comes to strengths, MedGPT has its own advantages. It is more versatile. It has a wider range of tasks. It is not, when it comes to all the medical domains, it is not particular domain specific. It has a more wider range of variety. Coming to BioGPT, it has deeper understanding of specific to biomedical concepts. So, which is better for specialized tasks. So, BioGPT is more domain specific. So, coming to the key takeaways, MedGPT, which is based on the GPT-2 architecture, which is a very strong transformer. So, it is known for its strong generation capabilities. So, this makes MedGPT well suited for tasks like text summarization, question answering, and creative writing in the biomedical domain. So we have creative writing, which is generating different text formats of text content like poems, code, script, and musical pieces, emails, letters, etc. So coming to MedGPT, when it is very specifically, it will be very informative and useful for medical document generation, medical transcription, data analysis of the clinical records. So we have patient details, we have symptoms, we have diagnosis. So when it comes to all of this, MedGPT will has proved very useful, and it will be even more useful in the future. So we have different generating different creative text formats of text content like poems, code, script, musical pieces, emails, letters in the biomedical domain. And MedGPT performs well on a variety of NLP tasks, which include question answering. So, if the model is trained on large amounts of medical information, it can very simply answer the medical questions from patients or healthcare professionals alike. And using text summarization, it can summarize the medical reports or clinical trials. So, for example, we have clinical notes taken by the doctors of the patient details. So, it can pick up the medical terms based on the model we have trained and based on the information we have trained it with. It can pick up it can pick up the medical keywords, and it can summarize a medical report, and it can also be proven very useful when it comes to clinical trials. So that is about MedGPT. Um, so that is about MedGPT. Thank you so much for